Welcome back. Health authorities in Europe, North America, Israel, and Australia have identified more than 100 cases of monkeypox in just the last few days.
Yeah, this is a thing. It's a surprising outbreak of a disease that rarely appears outside of Africa. Health officials around the world are keeping watch for more cases because for the first time, the disease appears to be spreading among people who didn't travel to Africa. This week, a top advisor to the World Health Organization said it was likely the outbreak was triggered by sexual activity at two recent mass events in Europe. So what's going on with all this?
Well, joining us now with more on monkeypox concerns, Chief Medical Officer of McLane Children's Hospital, Dr. Dominic Lucia, here to help sort out what's going on.
All right, Dr. Lucia, thank you for joining us. Let's start off with the elephant in the room here. What is monkeypox? I mean, this sounds made up.
Yeah, the name is strange, but it's a real thing, and it's actually been well studied. Several decades ago, it was recognized as a zoonotic virus, meaning it started with animals, and then, as you mentioned, really was concentrated in the Republic of Congo. Since then, we've had a few outbreaks around the world, and even in the U.S. back in 2003 related to pet prairie dogs. The symptoms are milder than smallpox, which has fortunately been eradicated. It's a 14-day incubation period. The rash then appears on the face and body, spreads to the inside of the mouth, hands and feet, and eventually scab and crust over. But as far as overall viruses and pandemics go, this one is generally mild, but still scary to see.
So what's the difference between something like this, a public health urgency, like this monkeypox has been classified, and a pandemic?
It's a great question. Really what we're doing right now is keeping a very close eye on it, tracking the data, tracking the evidence of spread, containing the cases that are known, and educating the public about it so it doesn't get any worse. When you talk about big picture pandemic and the COVID-19 virus, we saw that. That was massive. That was millions of deaths, and I think that's a very different scenario than we were seeing with monkeypox today.
So, doctor, how is it transmitted as compared to COVID? Correct me if I'm wrong, but it's not a respiratory disease?
That's generally true. It's a contact transmission. So most of the time when it's transmitted, it's skin-to-skin contact, usually through broken skin. There's some evidence that large droplets, which can only go about 2 to 3 feet in the air and don't stay in the air very long, can also transmit monkeypox, but that requires typically prolonged face-to-face time. That versus COVID, which was aerosolized and stayed in the air for a very long time to enter the respiratory tract.
So how concerned should we be?
I don't think we need to be hitting the panic button quite yet, and I don't think it's probably going to develop into anything major, certainly not compared to COVID. I think we'll keep an eye on it, keep up with the data, and because the route of transmission is much less contagious, because it's a milder virus, and because we've handled these outbreaks before, my concern for it isn't very high. I think when we talk about these stories, they're interesting and sometimes a little scary, but really the foundations of our own healthcare day in and day out are probably much more important. Our diet, our exercise, making sure as an adult you're attending your annual wellness exam, your cancer screenings, making sure for your kids they're getting their annual wellness exam and keeping up with their regular vaccinations. Those types of things are probably going to affect us in a positive way day to day, more so than worrying about this particular disease. That's
a great point. Control what we can control. Doctor, you're always a fountain of information. Dr. Dominic Lucia, McLane Children's Hospital, thank you for being here today. If we get another weird name disease out there, you'll be the first one we're reaching out to. Thank you very much. That is just straight monkeypox.
Well, chickenpox is also weird too when you think about it.
You're absolutely right. I never really thought about it because that's always been around. Yeah, interesting. Okay, Andy's got your forecast. Watching out for some storms. That's up next.